What's up, guys? This is Dr. Kyle coming at you with this week's movement tip of the week from Cape Chiropractic and Acupuncture. This week we're talking about hip flexor stretching do's and don'ts. Now, as a society, we sit a great deal, and what this does to our bodies is allow for specific adaptations to occur. Typically, when we're in the seated position, it causes what we call our hip flexors, or the muscles in the front of our thigh, and also up to our lumbar spine, to get shortened. Now, when this occurs, it doesn't allow for other muscles to work quite as well, especially our gluteal musculature. Now, what happens when these flexors get shortened is that we go into what our body calls, or our pelvis is called, is an anterior tilt. It's a certain orientation of our pelvis. Now, I like to think of the anterior tilt as kind of like a fishbowl or a soup bowl that is tilting anteriorly, almost spilling out frontwards. So you can see on the spine demonstration here, this is what an anterior tilt would look like. Now, when this occurs over time, it can create pain or it can create functional deficits. Now, what this hip flexor stretch does is help reduce the amount of tension in the anterior portion, or the hip flexor portion of our body, but more importantly, give us a window or an opportunity to help activate the musculature that doesn't get utilized a lot. Now, when you think about being in a seated position, these hip flexors are working so hard, our gluteal musculature doesn't get to work enough. Kind of think of it as the same balance as a bicep tricep. If you're using your bicep, you can't use your tricep. The same thing happens with your hip flexors and your gluteal musculature. It's called an agonist-antagonist relationship. So let's get right to it and show you how to maximize your hip flexor stretching. Now, first I'm going to talk about some common mistakes that I see with hip flexor stretching. Now, most people, when they get into their half kneeling position here, will not take care, I'm just tucking my shirt so you can see, to make sure that they stay in a neutral spine position. So just like we were talking about with the fishbowl or the anterior pelvic tilting, people tend to anterior pelvic tilt as they're doing this. And what that does is defeat the purpose of the stretch, because hip flexors cause that anterior pelvic tilt. So what we're trying to do is offset that. So first step is making sure that our spine is in a neutral position, not anteriorly tilted, not excessively posteriorly tilted. But what we want to do is get in a good 90-degree position with our front knee, and same in the back, just like so. And I want you to give a gentle squeeze with your gluteal musculature on the downside knee. So my right knee is down. I want you to squeeze the butt just a tiny bit. And then from there, you're going to stay nice and tall with your chest, and you're going to gently rock forward. Now, as you do this, you should feel a great stretch right through the front of your downside thigh. If you want to intensify this stretch, you can do so by squeezing the glutes harder, or also taking your arm up over the head. And you can also take a nice big breath in to intensify this stretch. Now, some mistakes that I see commonly, besides going into this anterior tilt, is people who crank themselves forward this way. Now, what you're doing here is essentially hyperextending through your low back and not really getting the stretch you need to. You're not able to activate the musculature that you want to if you're in this position. So again, you want to be in a nice tall position with a neutral spine. You want to give a nice squeeze in the gluteal musculature, and then gently rock forward, like so. You're not extending through your lumbar spine, just gentle glute squeeze, rock forward slightly, probably 1 to 3 inches maximum, and you should feel a nice stretch right through the front of the thigh. Cherry on top would be reaching up over the head, slight lean away, and then big belly breath in. Good. And what that does is help open up the hip flexors and allow for you to use your gluteal musculature more efficiently. Now, stay tuned next week as we're going to talk about safe ways to lift. Have a great week, guys. Thank you.